Let's bring in the President's point man on health care, the Secretary of Health and Human Services, Dr. Tom Price. Dr. Price, thank you for joining us.
Hey, George.
Good to be with you. I want to put up the President's promise made back in January. He said very clearly we're going to have insurance for everybody, much less expensive and much better. Can you guarantee that promise will be kept? Insurance for everybody at a lower cost?
Yeah, I think that's certainly the goal, and it's important for people to realize, as I know that you do, that the current system is not satisfactory for many individuals. We've got a third of the counties in this nation now that only have one insurance issuer on the exchange. We've got 5 states where there's only one issuer. We've got premiums that are going up, deductibles that are increasing significantly. So a lot of folks have a health insurance card, but they don't have any care. And if you look at the trajectory where the number of insurers that are going to be out there, the baseline that we've got right now is that fewer people are going to be able to purchase coverage. So what we want to do is fix the system and make certain that we put it in hands of patients and families and doctors.
You said that's a goal, but that's not the same as a guarantee, and a lot of people are concerned they're going to lose coverage. Independent analysts have said it could be in the millions, up to 10 million, according to Standard & Poor's. And the AARP, of course, they represent retired people, are warning it's going to hit middle-class, middle-aged Americans especially hard, dramatically increasing costs for those aged 50 to 64. One of them, the New York Times found, a woman named Martha Brawley from Monroe, North Carolina. We're going to show her right there. She was just diagnosed with liver disease, and under the new bill, she's going to get about $5,000 less than she gets under the ACA. Here's what she told us. I'm 55. This is the first time in my life I voted, and I voted for Trump, hoping that he would change the insurance so I could get good health care. I might as well not have voted. What do you say to her?
Well, it's 24 hours after the introduction of the bill, and I would suggest to Martha that what our desire is to make certain that you are the individual that is able to select the physician and the treatment that you desire for yourself, not that the government dictates to you. Remember that the current system, the trajectory of the current system is that fewer people will have health coverage on the exchange than currently. Nobody's talking about that. What we're trying to do is to fix a system that isn't working, George, and you know this.
But let me just stop you there, because we know the numbers right there. Right now, she's getting subsidies from the government. She's getting an Obamacare plan. Under the tax credits you propose, she's going to get about $5,000 less. That's going to put her coverage at risk.
What our goal is to make certain that costs come down, and that's the important thing. Costs have gone up for folks. There are people that now are unable to afford coverage. We were in a small business forum in Cincinnati just last week with the vice president, where a small business person had 18 employees last year. Now he has 15, only because of the cost of health coverage going up. So this is a complicated issue, there's no doubt about it, but for that individual that you identified, we want to make certain that she's able to select the physician and the treatment that she wants. That's the goal.
But under the analysis of the plan, that's not what's going to happen. Can you guarantee to Martha and people like her, especially those aged 50 to 64, that they're not going to pay more?
George, did you look at the state innovation grants and put that into your model? Did you look at the safety net grants and put that into your model? Did you look at the low-income pool and put that into your model? You can't pick out one individual and say this individual isn't going to be able to get coverage. Right now, people are losing coverage. We have a plan, we believe, that will allow individuals to pick the coverage that they want and the physician and the treatment model that they want, not have the government dictate it to them.
That's an analysis done by the AARP and Standard & Poor's, I should say. But final question, you also are facing this conservative revolt right now, Rand Paul and others. They want to move towards immediate and complete repeal. Are you going to have to move in their direction, and what can you offer them?
Well, it's a work in progress, as we've noted, but what we want to do is make certain that we equalize the tax treatment for health coverage for all Americans. Right now, the vast majority of Americans get their health coverage through their employer, about 175 million individuals. The people that are on the exchange, the folks in the individual and small group market, they don't get any tax benefit at all. That's what we want to equalize, and we've had this as a policy and a principle for years and years and years.
Secretary Price, thanks for joining us this morning.
Thank you, George.